Hey, everybody. I am Dr. Steve Johnson, and I want to welcome you to the webinar for today. The topic is inferential disputes in Rational Emotive Behavioral Therapy, REBT, when to challenge those interpretations that limit life. This is a relatively neglected topic. We often look at how to go about disputing beliefs, which are evaluations of situations and events, but we neglect to a large degree when to dispute inferences. It's in the literature, but we don't develop it very much. So let me just jump into the topic, and we have some terminology to begin with, and that is just kind of what I said. REBT kind of traditionally disputes irrational beliefs, or what I would often refer to as unhelpful beliefs, in that ABC model that is used in REBT. And beliefs are cognitions, or a type of thought that evaluates situations, events, and can lead to dysfunctional emotions and dysfunctional behaviors. And when we talk about dysfunctional behaviors within REBT, we mean those behaviors that tend to sabotage us or inhibit us in the attainment of our desired life goals. But before those beliefs come up, individuals form inferences, or they make attributions, or they give meaning or develop an interpretation of situations. Okay, so inferences are interpretations, attributions, or even giving meaning to situations. And while beliefs are tremendously important, we would say that they're the immediate cause or the proximal cause of emotional disturbance. Inferences are more distant, a distant foundation or cause that actually set the stage for beliefs to be formed. Understanding those beliefs are really important, and REBT focuses on that to a large degree, but also understanding the function of inferences, and when it's necessary, that we know how to dispute those patterns that can be really important when they become very rigid, global, they cross different domains of life, and they inhibit attaining our desired goals. So again, inferences are those cognitions. In REBT, there are two kinds of cognitions: inferences and beliefs. Inferences are those that give meaning to events or situations. In other words, the question that they answer is, what does this mean? They often involve these assumptions, interpretations, or even attributions of threat or opportunity to the situation or the environment. They're descriptive or predictive, but they're not evaluative, as are the beliefs. And some examples of inferences are: she didn't text back because she's upset with me. She may not have said she was upset, but that would be the inference, the assumption that we may make in that situation. Another one would be, this presentation will go badly. Again, it doesn't directly cause the emotion, but it sets the stage for emotional and even behavioral disturbance. Or another one is, life is getting harder and harder, and I just won't be able to manage things. And again, not really helpful if that kind of inference pops up in different domains of life. If we continue those core definitions, what I would say, and this is usually not in the literature, is that all inferences are assigning different types of threat. So all inferences have to do with the attribution of threat, but the content of that threat can differ. Maybe it's a threat to the self or their personal safety, or in anxiety, sometimes it's a threat to comfort or even predictability. In depression, we often see the threat of loss or failure. And in anger, maybe the threat of unfairness or violation of a value that is really important to me. Beliefs, on the other hand, and typically clinicians who practice REBT are very aware of these, because this is the bread and butter of REBT. Beliefs, again, are a type of cognition or a thought that evaluate situations. They don't give meaning to it, but they evaluate it. They answer the question, what should or must this mean? They are the direct cause of dysfunctional emotions and behavior as conceptualized by REBT. And we see 4 major categories of these beliefs. In particular, irrational or dysfunctional beliefs. The core irrational belief or category is demandingness. And typically in English, demands contain words such as should, ought, must, have to, or need. I must do such and such, or you should do such and such. And then the second category is awfulizing and catastrophizing. The next 3, awfulizing, catastrophizing, frustration intolerance, and global rating, are what we call derivatives. The core disturbance-producing belief is demandingness, and then to that, we can add 1 or more of the derivatives. And one of the very important derivatives is awfulizing, or what in our friends in CBT would call catastrophizing. This is awful. This is terrible. It's the end of the world. Frustration intolerance, which was previously called low frustration tolerance, is another one that we see pervasively within anxiety. I can't stand this. This is too much. And then global negative rating, and particularly global negative rating of self, others, or life, such as I'm worthless, people are awful, life is unfair, it's a vale of tears, whatever. And then Wendy Dryden has added another kind of global rating, and that would be the global rating of our thoughts or our cognitions, right? And so these we all know, and we practice disputing these beliefs, disputing and replacing them with more adaptive or more helpful beliefs. Now, I want to look at this chart that I created, and this shows the emotions and what core inferences are associated with these emotions. Anxiety, for example, the core inference is something bad is going to happen to me, or something is going to be really uncomfortable. The type of threat there is what we would say is a threat to our safety, our self-value, or our comfort. Example of this would be, if I lose this job, I won't survive. Again, it's an exaggerated cognition or threat. Whereas depression and sadness is usually the core inference is about loss. I've lost something that is deeply valuable to me, whether it's a person, a thing, a job, an object, whatever. And so the type of threat here is the loss of love or purpose, achievement, whatever. So an example would be, since that breakup, I'll never find happiness again. Again, these don't cause emotion, but they set the stage for emotions. In guilt, the inference is that I personally have violated an important moral or ethical standard, and it's important to me. The threat there is to my moral integrity, my self-respect, etc. And an example would be, I deliberately hurt someone I love. Hurt, kind of a complex emotion, because hurt can either go typically toward depression or toward anger, and sometimes it alternates between the two. But the core inference in hurt is that I've been treated unfairly and undeservedly, and that's a threat to justice, fairness, or deserved respect in some situations. So, for example, she dismissed me after all that I've done, and so that would set the stage for the development of the emotion hurt if the beliefs are dysfunctional. Anger, the core inference there is that someone has violated a moral or ethical principle that is important to me, one that I value. And so that threat is an ethical or to the ethical or social order. An example would be, he lied to me and I didn't deserve that treatment. So you can see in REBT, this is very, very helpful. We know with particular emotions that the meaning that is given to the situation or the event would be in the form of an inference, and we know typically what kind of inference we would find with that particular emotion. So that makes it much easier for us to form hypotheses about what the client is thinking, and we can be more efficient in working with the client. And if they get stuck, we can pose it in the form of hypothesis to them, which they can either accept or reject, etc., and help us move down the road in the conceptualization of emotions with that client. And how do we differentiate inferences and beliefs? It's pretty simple. Beliefs trigger kind of emotional intensity, behavior, whereas inferences determine emotional direction, what kind of emotion we would feel. Whereas triggering a belief will be viewed in the emotional intensity and the behavior associated there. Very important thing to consider. Before we move forward, though, in terms of what do we do with respect to inferences that are dysfunctional, I want to say a little bit about why in REBT we tend to focus on beliefs more than inferences. Again, we're not saying that inferences are not important. They're very important, and often we need to address them. And we ask about them when we do a conceptualization of emotion. By the way, if you go to my YouTube channel, Psychotherapy, Education, and Training, you will see I have videos on how to do an REBT conceptualization of emotion, which is vital if someone wants to practice REBT competently. Excuse me. But why do we in REBT tend to focus so much on beliefs? Well, we hold that beliefs are the direct, or what we might say the contiguous or the close cause of emotional disturbance. They determine whether an emotion is functional or dysfunctional. For example, do we have concern or do we have anxiety? Do we experience sadness or are we experiencing depression? The beliefs will do that. The inferences will not. In fact, the inference for concern is the same as the inference for anxiety. The inference for sadness will be the same inference for depression. However, the beliefs that give rise to concern are quite different than the beliefs that give rise to anxiety, and the beliefs that give rise to sadness are quite different than the beliefs that give rise to depression. So inferences, although they're very, very important, are one step removed from the dysfunctional emotion and behavior, but they do set the context in which the beliefs are formed. If we didn't have the inference, we wouldn't have the beliefs about that situation or the event. So therefore, because the beliefs differ in different emotions, it is really important to discern those beliefs. And so REBT, traditional REBT, will first target beliefs for disputation. Disputation would be the D in the ABCDE model. Okay. If at any point you do have questions or comments, just place it in the comment section, and toward the end, I will be addressing those comments, okay? When do we dispute inferences? Well, before that, when do we dispute beliefs? We will always be disputing beliefs within REBT. Sometimes we may do an emotional intervention, an emotive intervention. Sometimes we'll do a behavioral intervention, but rarely will we not do a cognitive intervention where we will be disputing beliefs and replacing them with more helpful adaptive beliefs. So, but when do we do inferential disputes? Well, of course, we do it when they're clinically important. An inference, when it becomes a life theme, is really important. That means we have this habit of forming this inference. That means a habit of giving a particular meaning to situations or similar situations or events, and they cut across situations. When we have inferences that cut across situations in life, we call that a theme, a life theme. And so if we have a life theme that is not helpful, that is setting the stage for dysfunctional emotions and behaviors, we need to look at that and most likely do an inferential dispute. If the inference generalizes across domains, so for example, in your work life, or in your relationships, or in health, or your spirituality, or even in your free time, these are different domains of life. But if that inference is popping up across domains of life, then it is potentially negatively impacting you in multiple situations. And so it is time to most likely do a dispute of that inference. If it limits vitality, quality of life, exploration, taking measured risks, etc., leading to more, smaller, more constricted living rather than living a full and exciting life, then it's most likely we are going to do an inferential dispute. Or if the beliefs are rational. Sometimes individuals have inferences, they have rational beliefs, but the inferences are inaccurate, they're rigid or catastrophizing, and they set the stage for beliefs so that in a time of weakness, for example, or emotional overload, then the individual would be more likely to form some negative beliefs and experience dysfunctional emotions and behaviors. So these are general situations and times when we do tend to engage in the dispute of inferences. Examples of these. And if you look at the category here, we would be looking at the life theme. That means they have inferences in several domains of life. So I give an example, and then what would be the impact on life? Let's say the threat to coping ability, the ability to cope with things in life. Well, the inference might be life is too challenging, I'll never manage. And of course, that will have quite a negative impact upon the individual because they're going to avoid new opportunities that might be enjoyable for them or connect them with other people, just be exciting, or they may have chronic self-doubt, low resilience, they have difficulty bouncing back after encountering a negative event. Another would be threat of rejection. If the individual sees threat of rejection in multiple domains of life, that's a life theme, and it's not a helpful life theme. So, for example, such an inference would be people always end up leaving me. And you can imagine that may lead to desire overprotection, dependency on people, fear of intimacy because they're afraid that they're just going to get, kicked to the curb or left in the dust. People will just drop them. So that inference is not really helpful as a life theme. Fear of failure. If you have, if that's popping up in different domains of life, then an example of that kind of inference would be, if I try, I'll probably just mess it up anyway. Well, of course, that could lead to perfectionism, which is utterly dysfunctional, procrastination, which would kind of end up being a self-fulfilling prophecy. If you believe that you're going to mess it up and you procrastinate, therefore, then you are more likely to mess it up. And it could also lead to underachievement, which is not really helpful if you are wanting to attain particular life goals. What about the threat of unfairness? That could be a life theme if that pops up in different domains of life. So here an example would be, the world is rigged against me. Okay, we may see individuals with chronic resentment, they're disengaged, they don't connect with life and others, and they have more of an external locus of control rather than the inner drive to achieve. And then finally, the threat of a vulnerability. If I open up, I'll get hurt. That can be utterly dysfunctional, and the more domains of life where that pops up, the bigger the problem. Because that could be exemplified in emotional numbing out, lack of authenticity, trying to be something that you're not, or relational distance. And relational distance is quite negative because it is connecting with other individuals, in which we produce toxitocin that gives us a sense of connectedness and quality of life. Excuse me. How do we dispute, and then after we dispute, replace those inferences that may be setting the stage for some emotional challenges and behavioral challenges? When an inference becomes extremely rigid, it's self-limiting, it's limiting the individual to open up, take measured risk, experience all kinds of things in life, maybe connect with people that would enrich their lives. REBT practitioners may apply three kinds of disputes: empirical, logical, and functional. These are similar to the disputes of beliefs, but these are aimed at interpretations rather than negative and unhelpful evaluations. And we'll look at that. Here are some examples of empirical, logical, and functional disputes. Empirical disputes are to ask the question and answer the question, is this inference true? Inferences are either true or false. Beliefs are not so much true or false as they are helpful or unhelpful. So if we have an inference that's unhelpful, or false, then we could engage in an empirical dispute, and we would ask these kinds of things of the self or of the client, and eventually teach the client to pose these questions to themselves so that they can counter their own dysfunctional inferences. What's the evidence that life is too challenging for you to manage? Or what's the base rate? How often has that prediction actually been accurate? Or is it inaccurate sometimes? So that is getting at the truthfulness or falsehood of the inference. What alternative explanations fit the facts? Again, that's a very powerful challenge. In addition to that kind of empirical dispute, we could also engage in logical disputation. And that is, how does it follow? How does it logically follow? Does it logically follow that one difficult week means life is unmanageable? Of course not. Is there a contradiction between your inference and what you've handled before? So that was really interesting, because then we can hold up, you know what? there are times when there is a difference between the two. Or a functional dispute. And for many people, this is the most helpful and most powerful for them, because we ask, is it helpful? Is holding this inference helpful? And posing questions such as, how does it serve you to keep viewing life as too difficult? How does that impact you? What do you do or not do when you hold that inference? What happens when you act as if that inference is true? Would an alternate or an alternative inference move you closer to achieving your goals and the values that you hold and use when you think about life events? So this is how we would dispute inferences. And again, the truthfulness, the logicality, and then also the pragmatic functionality or helpfulness of that particular inference. Now, let's just take an example. Let's say we have a client whose inference is, life is too challenging. I can't manage. What's the result of holding that inference? Well, they may avoid change because they will see that as adding to complication. They may retreat to comfort and in avoidance in that way. They may hold the philosophy of life that they'll act so that there's short-term relief, but long-term dysfunction. Competency in life and success in life typically follows the exact opposite kind of principle or life principle. We would embrace short-term pain for long-term gain, and rather than short-term gain but long-term pain, which we see in addictive disorders and all kinds of mental and emotional conditions. And so let's look at that disputing process there. Empirical examples of empirical disputes would be, what challenges have you actually faced successfully, right? Because if you've you've faced them successfully, that's a challenge. What evidence suggests that difficulty equals impossibility? Simply because something is challenging or difficult does not mean that it's impossible. And if you set the stage, then you're more with the more helpful inference, then you may be more proactive and take on the challenges. Logical would be, if life's too challenging, how are you functioning right now? Right? How are you getting through life right now? Does one area of struggle logically mean that all life is unmanageable? See, they globalize or they aggregate situations and then overgeneralize there. Functional dispute. What happens to your growth when you interpret life in that way? If you saw challenges as opportunities for growth rather than threats, what would shift in your life? What would you be doing then that you're not doing now, or the opposite? And so once we go through this process, then we could help the client develop a rational alternative inference, such as, life can be challenging at times, but I've managed before and I can learn to handle what comes. It may not be easy, but it is doable with effort. Okay. So let's look at, how could we integrate the disputation of inferences with the disputation of beliefs. As I've said, typically in REBT, we dispute beliefs, but there are times, as we've covered in this lecture, when we would be more proactive about disputing inferences that are life themes that are unhelpful, and would thus set the stage for dysfunctional beliefs. So we would, the flow or the sequence of the flow in the disputation would be, identify the inferences, what the client perceives is happening, the kind of threat that they're attributing, then identify the belief, how the client is evaluating that perception, dispute those dysfunctional beliefs first. Why? So that we reduce the emotional disturbance. Because if we do that, then it's going to be easier to dispute the inferences. Then we revisit the inference if it recurs, especially if it recurs across or limits long-term functioning. If it cuts across multiple domains of life, the more domains involved, the more difficult it is and the more dysfunction that it may give rise to, and would limit long-term functioning. So we would want to revisit that, and we would encourage forming balanced, flexible, and probabilistic interpretation rather than unbalanced, inflexible or rigid, and absolutistic interpretations. So a balanced, flexible, probabilistic example of an inference would be, it might be difficult, but it's manageable. I might not like it, but I could handle it. Those would be more helpful inferences. So you see, we move away from the rigid, imbalanced, and the globalized inferences to those that are balanced, flexible, and more probabilistic, and more scientific in nature, right? And more helpful thus. So what I want to summarize here, and then if there are any comments, I will take those. But what I want us to look at is that inferences are interpretations. They're interpretations of events or situations that the client is experiencing. And those inferences shape our perception and the direction of our emotions. Beliefs, on the other hand, are evaluations. They directly create dysfunctional emotions and behaviors. Okay? Inferences set the stage and they shape the perception and direction of emotionality, but the beliefs are more contiguous and they directly cause the emotions and behaviors. So beliefs within REBT are going to be the primary targets, but inferences may require disputation when especially they are restricting life and in the form of restrictive life themes. So effective inferential disputes for that kind of an inference, the dysfunctional inference, is we ask the following three things. Is this interpretation empirically accurate? Do data support it or not? Is it logically consistent? Does it logically follow, or is it illogical? Is it helpful, or is it self-defeating and inhibits the attainment of desired life goals? All very, very important kinds of issues. So here's what I'd like to close with, and that is, what life theme inferences have you heard repeatedly from your clients? If you're seeing those, it is nice to kind of prepare for that in advance if those are ones that are popping up. And so you can, get ready for that. What themes do you notice in your own interpretations? Maybe you form themes about clients of a particular nature. So what are those themes? And do those themes in the form of inferences get in the way of you effectively counseling those clients? How might disputing these at the inferential level expand the life possibilities for clients? Help to make their lives richer and more exciting, such that they take measured risks and their lives are full, and they can model that for their children. And if you're in a position of authority, then those who are your colleagues and work with you can see you modeling that behavior and how helpful that is. Okay? So here's a recommendation that I have, that you consider joining Psychotherapy Education and Training. It's the YouTube channel that I developed several years ago, and that now offers exclusive training programs, REBT, free supervision days, and also helpful handouts. In fact, this video will show up it's streaming live on YouTube now, but after this, the video will be available, and in the description of the video, you will find a direct link to where you can get a handout on this very topic for absolutely free. But if you join my YouTube channel, you'll have access to all kinds of those freebies. All you have to do is click join, and there's a nominal monthly fee. It's around $6.99, and that is far less expensive than the price for attending even one workshop, which often is hundreds of dollars, and in some cases, if there's certificates involved, may even top thousands of dollars. So this can be really, really helpful. So I want to thank all of you and have you consider taking more of these webinars that I do through YouTube Live. And if you miss it, if the timing's not right for you, you can always see these programs and watch them at your leisure on the YouTube channel. But if you want more, if you want to go more deeply into REBT, or even if you want to look at how REBT can be united with other models, recently I created a video on how we can use the DBT technique of wise mind with the disputation of beliefs in the and use the REBT self-help form to do that. And there's a video on how you do that. And then there are handouts that go along with those. So I hope you do consider joining. But if not, you can always take a look at the videos that are on this channel. Again, I thank you so much for taking some time off out of your precious time off and joining us today. Have a great day, and hope to see you in future such webinars. Bye-bye.